It's actually all of the above, even though it's sort of a trick question, because you might think, well, why is evidence from other cases relevant? The reason why evidence from other cases may be relevant is because you might have a case with a knee surgery and you had another case where you know from a doctor's opinion what the value of that particular knee surgery is. So you may use anecdotal evidence from other cases to help you with your evaluation in your case. So A, B, and C is kind of correct. All of the above is the right answer on that one. But good job, everyone, in getting that. And we're going to pass to Cody. Oh, no, not yet. All right. So we want to be really clear on this, everybody, about what an exposure evaluation is. An exposure evaluation is a very detailed, informed analysis based on the evidence and the jury verdicts in the case about what a jury in this venue will do. It's really, really important to back up your analysis with data, with information, and not to just make guesses. And I know that sometimes you are providing sort of a gut feeling of what the case is worth, and that's okay. But your gut feeling is always based on something. It's always based on your experience and your knowledge of how juries, may react to a case like this, and what you know about how bad the damages are in the case, how bad the vehicle damage was, for example, how bad the injuries sound, anything like that. So you are factoring in these things, even when you're giving what feels like a gut response on a case. What an exposure evaluation is not, make sure it's not your personal feelings, for example, as a 13th juror. It's your opinion as an attorney based on the facts and the law, but it's not what you would personally do. Remember that in a lot of cases, we are sort of jaded defense attorneys, and you don't want to provide your opinion about what we would do in this case, because it may not be what a jury would do. So keep that in mind. Don't just provide speculation. Make sure that it's based on something. Don't make it a doomsday scenario. And we'll give you an example of that in a second. And on the flip side, don't over-posture the case. Don't over-advocate or oversell the case. If you prepare your evaluation in a methodical and thought-out way, it will look strong and confident. You don't need to add strong and confident words or oversell and make it sound like we're going to get a better result than we could actually get. Sometimes you might be tempted, hey, the client's told you this case is worth nothing, nominal value or whatever, and you might feel like, well, I don't want to make the client mad. It's got to be your opinion. It's got to be a reasonable opinion based on the evidence and the jury verdicts. So don't let the client's opinion impact your opinion. But, maybe the client's opinion is based on something, and have that discussion and understand it so that you understand what's factoring into it. But don't feel like, hey, I can't say this is worth this because the client thinks it's worth so much less. And again, don't just guess at it. I mean, make sure, you can use your intuition somewhat, but make sure that it's based on something. All right, this is an actual example that we've used in this PowerPoint before. I'm keeping it in the PowerPoint because it's such a good example of what not to do. This is a case that, we took over from another firm, and this was the exposure analysis that had been provided by the other firm. I'll just read it to you. It went like this. The questions remain: how do we convince a jury that $25,000 per broken rib is too much, and that $5,000 to $10,000 per rib is more appropriate? Why not $30,000 per rib instead? How can we credibly assert that $1 million is too much for the permanent limitation on the use of his arm, which also eliminated his ability to work in his chosen profession? Why aren't 2 major back surgeries with a spine fusion and months of recovery and therapy not worth $1.5 million? Why not 2 million? Why not more? The bottom line is that there are no answers to these questions, despite all our efforts to find a way to reduce the insured's exposure. All right. I know it's an obvious example, but it is an example. You can see right here, there's more questions than answers. in this analysis. There's actually only one, I think only one sentence that has a period at the end of it. So it's sort of a, it's an extreme example of what not to do, but you can understand why the client was a little bit concerned after receiving this evaluation. And you can understand how this evaluation just didn't help the client to make any good decisions in the case. So what not to do. I'm going to pass to Cody now to talk specifically about how to prepare an effective exposure evaluation.
Thank you, Nina, and hello, everyone. So now that we've seen the poster child of what our exposure evaluation should not look like, let's talk about what it should look like. And I apologize, it looks like I'm having some technical difficulties. So in every exposure evaluation that we prepare, we recommend, and our best practice is that no matter what type of case it is, your exposure evaluation should include a low, a mid, and a high range. And we'll get into the details of what the ranges are going to include. But first, we have to see what it looks like in practice. So before we get to low, mid, and high ranges, we recommend that your exposure evaluation section include a preamble. And the preamble may include various factors depending on your type of case, depending on the stage of the case where you're at in litigation, the information that's known, the information that you're anticipating may come to light, the verdicts that you've looked at. And this is really your opportunity to provide some qualifiers, since a lot of exposure evaluations are based on quite a few assumptions. So you're just wanting to advise the client and the carrier that there are some qualifiers or disclaimers, if we want to call them that, so that they understand that we haven't pulled out the crystal ball. This is not perfectly finite, that this is just our best objective analysis with the information that is known to us, which includes the jury verdicts that we've looked at. Depending on the case, this may be an appropriate section to also comment on the credibility of the parties. Sometimes if you have a plaintiff whose claims or testimony or pre-existing history in a PI case, maybe there's a huge question about their credibility and how a jury may or may not respond to that credibility or lack thereof. This is a good section of your report to comment on that. The example that we have pulled up here was from a personal injury, TBI, and facial disfigurement case. We did take the opportunity in this preamble to comment on the average verdicts in the particular venue in these types of cases. But we also commented on the fact that there was a case that was substantially similar from another venue, similar venue, that was much higher than the average. So again, this portion is really trying to manage expectations. And that's before you get into the specifics of your low, mid, and high range. So as I mentioned, we've got low, mid, and high ranges. In any case, best practice, your low range is going to be a representation of what we think the jury will do if they're buying pretty much everything that the defense is selling. This is assumed liability. So it's not an opportunity in the low range to make a representation that a defense verdict, may or may not be likely. This assumes that the jury's already found liability, but that the jury would be buying the defense damages figures in large part or wholly. The flip side of that, your high range, is that the jury is buying what the plaintiff and the attorney and the experts are selling. Oftentimes in this high range, the figures that you are anticipating plaintiff's counsel will throw out there are going to exceed the policy limits. So your high range may simply state substantial, depending on what the available policy limits are, or it may be a range of a specific number to substantial, or if that high range is still within policy limits, as the example on the screen shows, you can have a range based on numbers in its entirety. Now, the mid-range is, in every case, what we believe, based on our objective analysis, a jury is most likely to do, meaning the most likely outcome of the case, if it went to verdict, is going to be represented in the mid-range. So what do we need to include in our exposure evaluations? Well, I think Bruce Willis is going to give us the answer to that question.
Say, I close in about an hour. Maybe we can go get a drink?
Just the facts, man. Just the facts.
That's right. As Nina mentioned earlier, this is not our opportunity to guess or pontificate. We really just need to stick to the facts, what information is known, and then also tapping into the verdict analysis and anecdotal information. So it's not a situation, even if you're asked to do an exposure evaluation early on in the case, maybe you only have written discovery responses. You don't have defense IMEs yet. You certainly don't have plaintiff's expert reports. That doesn't mean that you don't have facts and objective evidence that's not available to you that you can rely on to offer our evaluation. So where do we start? Sometimes this can be the most difficult question. Well, I don't even know how I begin my exposure evaluation. We recommend the best place to start is pulling up the verdict form for the cause of action or causes of action that are at issue in the case. The verdict form is going to provide you with the recoverable elements of damages that you can use to springboard and work backwards to review the file and pull the information that you need. So the example on the screen is from an admitted liability personal injury case in California. So the plaintiff's recoverable damages were past and future medical expenses and lost earnings, and past and future non-economic damages for pain and suffering. So that was the parameter for the exposure evaluation that we needed to start from. The next step is coming up with damages assumptions for each one of these elements of damages. So where do our damages assumptions come from? Again, using this case as an example, the PI case, we need to make assumptions for each one of those categories of damages. So for our past medical specials, what we're trying to determine is, well, what was the reasonable and necessary treatment that the plaintiff underwent as a result of the injuries that were sustained in the accident, and what is the reasonable amount? For future meds, what is the reasonable and necessary treatment that the plaintiff will need in the future, and what is the reasonable amount? Past and future loss of income. For the future, it can be a question of, is the plaintiff going to be prevented from returning to any work for the rest of their life? Are they going to be prevented from returning to the specific type of work that they were doing, but they are have capacity to take another type of line of work? Or are they going to have a reduced work life expectancy for the injuries? So lots of variables that go into determining the scope of that future loss of income. And then, of course, the non-economics. Depending on your jurisdiction, there's going to be formulas or case law that apply. So in California, of course, for our past meds, our birthday boy, Bob Tyson, he established what the rule is in California for recovery of past meds with the Howell decision. So here it's the lesser of the amount that was paid by plaintiff or plaintiff's insurers, or the reasonable value. So if it's early on in the case, typically the numbers that you're going to have available to you are whatever plaintiff's insurance paid, or if plaintiff's treating on a lien, the full billed amounts. So you may feel stumped and think, well, how am I going to come up with a damages assumption beyond what the plaintiff is claiming if I don't have experts on board, I don't have a medical billing expert to offer an opinion, I don't have doctors yet? Well, this is an opportunity, as Nina mentioned before, where you can resort back to cases that you've personally handled that are similar. Maybe you've got a similar plaintiff's attorneys, so you have an idea of the experts they might use. You can look at those experts' prior life care plans or opinions from that other case. Oftentimes you can look at jury verdicts. Those might inform your decision as well. Same with the future meds. And the jury verdicts really are informative in giving you those damages assumptions for your non-economic damages. I really encourage everyone to do a deep dive with your jury verdicts, not just looking at the bottom line, but really trying to do a synthesized analysis of any trends or patterns that you're seeing in a particular type of case or with particular plaintiffs' attorneys or experts. Looking again, not only at the full verdict amount, but is there some type of proportion of economic damage awards versus non-economic damages awards in a particular case with particular injuries or claimed future impairment.
Cody, can I jump in here real quick on the jury verdicts? So this is an example of a scenario where you have a gut feeling about what the case is worth, and you want to be able to explain that to the carrier. The jury verdicts are the best way to be able to do that, because you're going to be able to find a jury verdict that is similar to the way you feel about the case. And if you can anchor your feeling about the case in an actual verdict, it's going to come across a lot better, a lot more informed, a lot more methodical than if you're just kind of picking a number out of thin air. I always feel that when I'm able to explain this analysis to a carrier or a client, and I can actually walk them through a case, or I can walk them through these assumed damages, it really answers a lot of questions that they have, and they'll be more comfortable with your analysis if they feel like they understand where it's coming from. So that's just another real good reason why you want to do that deep dive into the jury verdicts. Sorry, Cody.
Absolutely, yes. And you may not have a verdict in your specific venue that is factually on all fours. So again, I would encourage everybody, go outside of your venue, take a look, because there may be a case that's exactly like your case. And it may be, for example, a specious TBI case where there's no loss of consciousness, all the scans are normal, but you have a young person and you've got experts who are saying that they're going to develop early onset dementia down the road and that their future is going to be bleak. And there may be a verdict in a neighboring venue where the jury awarded a large amount in future meds and non-economics in a case like that. So that can really be a good springboard for a discussion with your client and your carrier, as Nina mentioned.